take a refresher course on dental care. You brush your teeth every day. Hopefully you floss your teeth as well. Eat a healthy meal. It's about time we talk about dental care. There could be something you're forgetting, and that's why we are doing this particular topic. Dental care and making it preventive. I'm joined by the awesome Dr. Joyce Gitangu, award-winning dentist, loved here in Kenya. Karibu sana on your own set.
Yeah,
beautiful place you have.
Asante.
Beautiful
Thank
place.
you for having us. Yeah.
No, and thank you for your time.
Yes,
thank you for your
we
time.
appreciate it.
Speaking of dental care basics, we've walked around on this earth for a while. We feel that we know what to do. I mean, really, we are brushing our teeth. What more can you tell us? Or what can you tell us that we don't know?
Yeah. So I think, first of all, this month, March 20th, is World Oral Health Day. The theme for this year is Be Proud of Your Mouth.
Be proud of your mouth.
Yeah. So what that means is we have to take a value, for our teeth, right? Which means we have to really understand that it is so important to invest in our oral health care, because it not only affects just our beautiful smiles, it also affects our overall health.
It's the gateway to our health.
It is the gateway. Everything comes in through your mouth, so we have to really understand the importance of oral health. So one thing that I must put out there is, there's not been a lot of public health awareness when it comes to oral health. And I think it's important for us to engage policymakers, the oral health community, the general community, so that we can understand the seriousness, so we can be able to reduce the burden of dental disease.
Right.
And of course, we have to understand what dental disease is. Number one, we know that the obvious one, the decay, which is when most people reach us, when the tooth is hurting, they can't sleep, they have infections.
That's the typical time that we will come in and say, I'll come and see a dentist when my teeth are hurting.
Yes. Then we also have gum disease. Most people will come, their teeth, maybe the gums are swollen, the gums are bleeding and such. So we do have those type of people who come usually when gum disease also has gone further than what it should be, and poses a risk of tooth loss, drifting teeth, and etc. Then we also do see a lot of kids. So most parents would come to see us obviously when they have that wiggly tooth. And obviously it's always a good avenue for us to be able to reach out and start educating them early about the importance of oral health. Then we also have now a lot of things now with a lot of facial pains and joint pains around the face. So we do get a lot of patients. Yes, we do have patients who come in with chipped, fractured teeth because they have certain habits such as clenching or grinding their teeth causes facial pains and the joint pains.
Is it something neurological?
It is definitely something, especially stress induced. Anxiety, of course, last year, unfortunately during COVID, a lot of people were stressed, so we did see a lot of people presenting here with TMJ pain, and the facial pains, they're really stressed and fracturing their teeth. So of course, we haven't gotten to that place where most people are coming to the clinic just, it's time, I'm due for my checkup or I'm due for my cleaning. So there has to be a lot of awareness more on a macro level so that we can be able to reach everybody.
And that's why we are having this conversation, because like you've just said, a lot of us will come in when my tooth is wiggly. I wouldn't come here unless really and truly I am in so much pain, which shouldn't be the case.
It shouldn't.
And it's why I think it's important for us to have this conversation when we talk about preventive, which should be a big thing, because prevention should be the way we should be going.
Yeah.
Tooth decay, what can we do to prevent tooth decay? Yeah. What can we do at home? Especially say, let's start with adults. What can we be doing?
So, of course, prevention is better than cure, right? And it all starts at home. Oral hygiene starts at home. We're just there to kind of help you, motivate you through your journey, your oral health journey. But number one, brushing should be twice a day. Most people brush once a day.
So it should be twice a day.
It should be twice a day.
Even for adults, brush your teeth twice a day.
Twice a day, definitely twice a day, in the morning and at night.
For how long?
2 minutes.
Minimum.
Yeah, it should be 30 seconds per quadrant. So if you're going to start on your upper right, go to your upper left, then lower left, and then your lower right, it should be 30, 30, 30, 30. It's good for especially the kids to have a timer so that they can enjoy the process, because they love those type of gadgets. So that we can keep the 2 minutes is what is recommended. Of course, flossing is also something that I see most people not doing.
What percentage of Kenyans, for example, do you think floss their teeth?
20%.
That is low.
That is very low, but I can't blame them because there's also
And
not
we
been
don't know.
there's no awareness. And even for those that know, the technique is not proper, so it's almost that they're not flossing.
What should be the technique?
The technique has to follow the tooth, the curve of the tooth, all the way down into your gums, because the idea is cleaning between the gums, all the way down into your gums, because that's where the bacteria is trapped.
Right.
So, so flossing once a day. Rinsing is not really necessary. But
I didn't know
if
that, by the way.
Yeah, rinsing, you can rinse after brushing. You can rinse with water. You can rinse with warm, salty water. If you have a non-alcohol-based, mouth rinse, even a plus. But it's not something that, is really pushed as part of the routine.
So say that again. We can brush our teeth,
Yes.
but we don't have to rinse.
Yes. You can
You learn
rinse.
something new every day.
Yes, you can rinse just to kind of remove whatever is in there.
And clean up and all.
And clean up, yeah. Then, of course, see the dentist every 6 months. Just come, see us, we do a checkup. We do x-rays every 2 years, especially if you're a high caries risk, especially with children.
Right.
We are able to detect things in between the teeth, because obviously we cannot be able to see in between the teeth with our normal eye. So we'll have to take the x-ray so we can see in between the teeth. So it's a good practice to just kind of come. Also, there are things that we also do take a notice, especially with adults. Like I said, oral health is obviously linked with your general health. There's been a lot of correlation with diabetes, right? So we do see a lot of patients that have, gum disease, severe to advanced gum disease. They might also have diabetes.
Wow.
Then we also have the correlation with heart disease, the bacteria that is found in the mouth. Somehow it is linked to heart disease. And then also research has further gone to show that, it's related to pregnancy too. We see a lot of low weight births and also preterm labor has been associated with gum disease.
Oh, wow.
Yeah, because whatever is inside you is traveling inside to the baby, right?
Cool. So during my antenatal, I'm just thinking, one of the things I need to do in the course of preparing for my baby should be then scheduling to come in and see a dentist as well.
Yes, we're not going to take any
I've never
x-rays.
had anybody talk about that.
We're not going to take any x-rays. We're not going to do any fluoride treatment. We're just going to do a good cleaning, because that bacteria that is stuck in there, if it travels down and can affect your child, especially if it's, advanced gum disease.
You learn something every day.
Right.
Something new every day.
Yes.
Mouthwash. Should we be putting it in our shopping basket? Is it a fad, or is it something we need to be using and regularly?
I think mostly when people have bad breath, obviously it's a good way to mask that bad breath, but of course we know that's not the cure to bad breath, right? So I think as far as mouth rinse, it kind of helps to just remove whatever the brushing and the flossing did. But you see, we are pushing more on a proper brushing technique and good flossing technique. And with that, you can be able to clear off whatever is in there. There are some children, especially in areas where, maybe the fluoride levels are low in their water. We could also add maybe a mouth rinse that has fluoride. It's usually rare in the case of Kenya, but for adults, most adults who present with advanced gum disease, we will prescribe a clinical mouth rinse to kind of help reduce the bacterial load in their mouth.
Okay.
So it is not something that I push for. You can have warm, salty water, which works really good. It helps to heal the gums so that they're not bleeding, and of course also reduce that bacterial load in your mouth.
Interesting.
Yeah.
As we are wrapping up this conversation, Dr. Gitangu, what we are eating, what we are drinking. What are the things we should be avoiding when it comes to dental care 101?
Yeah.
What should we be avoiding?
I think that is very straightforward, right? Of course, our candies, I mean, it's kind of hard to say don't eat candy, and especially for children. I mean, it's part of life. What I just say is do it in moderation.
So everything in moderation.
Yes, but also there are certain candies, I must say, that kind of cause more damage. So like our sticky candies, like the toffees.
Oh, we used to love toffee.
Yes,
goody.
Chewing
goody
gums.
Goody is back, by the way.
Goody.
I shouldn't be saying that.
Yeah, yes. Goodies and stuff like that. They're horrible. They stick. So they stay there, and also they get stuck in those little pits which are very hard to brush.
So brushing once a day?
Brushing once a day with improper technique, so we're not getting that stuff out. Then, of course, we have like things like lollipops that, parents love, and you can imagine a child is sucking that thing for like 30 good minutes. You can imagine how much how much sugar is just being pulled in the mouth.
Right.
Then, there's another thing where most people think that things like yogurts are healthy, but they are infiltrated with so much sugar. So in terms of yogurts, especially for children and young children, let us stay away from these flavored yogurts, the vanilla, strawberry.
Are they natural yogurts, like natural?
Do the natural yogurt. Your child can do it.
We could make our own yogurt at home.
Yeah, that would be even much awesome. I know it's an art, especially to make it very tasty,
Yeah.
But even for the parents who struggle with natural yogurt, giving it to their children, they can add a fruit. They can add bananas, they can add berries in there just to kind of sweeten it up. Do not add honey. Honey is natural sugar, right? It's
still sugar.
It's still sugar. Yeah, it is still sugar, So, but if you can just, when the kids are young, just accustom them to having natural. It's harder for them to switch to natural if they've been doing the flavored ones.
Absolutely.
The same thing goes to milk. I see children sipping on that thing in the morning, at night, flavored with sugar.
And it's
and it is as much as sometimes a Tetra Pak of it has almost, 2 teaspoonfuls of sugar, that's a lot, 10 grams of sugar, and your child is so young, 2-3 years old, and is sipping this thing, and then you're thinking, my child is having milk is
healthy,
good, it's very healthy. So children don't need sugar, I think it actually does affect even the way they appreciate good healthy food, such as vegetables, which are very important, especially with teeth, right? Diet is key, and that's one of the things we kind of go through with our patients when they come in, because we do have patients who come in even as young as 6 months.
That's young.
They only have 2-3 teeth, but you see now that's a gateway also for the parents to start learning good habits that can be started very early, and then we prevent dental problems in the future.
Today was about talking about prevention, and of course back to dental care 101. Just to run us down as we wrap up. Number 1, brush your teeth twice a day.
Yes. Floss,
very important. Learn how to correctly floss.
Proper technique, and then of course come see the dentist every 6 months. A professional checkup, a professional cleaning is very important. Then of course we have to watch our diet.
Absolutely.
Nutrition is very important to our teeth, but also just our overall health, right? Avoid all that sugar, have foods that are high in sugar. Increase more vegetables in your diet, right? Then I guess, we'll see you in my clinic.
And on that note, we thank Dr. Joyce Vitangu of Dental Smiles. Thank you so much for hosting us. And back to you at home, the most important thing is prevention is better than cure.
Prevention is cheaper.
Something for you to think about.
Yes.
Let us schedule in that dental appointment, because prevention is better than cure. See you in the next episode.